Hello, everyone out there. Thanks for joining. This is our first educational webinar series. My name is Kyle Watstrom. I am the clinic operations manager here at Brand New Day. Basically, I help run the day-to-day at the clinic here, work alongside our patients and clients through the different medical devices that we have. And alongside me, I have Steve Sanborn. Steve, if you would like to give a little brief introduction on yourself.
Sure. Steve Sanborn, and I am the sort of CEO, president, head guy here at Brand New Day, and function with also a business partner who doesn't work on the floor or anything, but Dirk Antonis is also part of our business model. And we've been functioning now 18 months, excited to continue on, and happy to tell you all a little bit more about myself as we go along.
Awesome. Awesome. Thanks, Steve. Yeah, and just want to thank you for tuning into our first educational webinar here. This is more of a get to know you. I'm going to share my screen real quick and kind of give you a rundown of what to expect for today. So on the agenda today, we're going to begin with a welcome video just to give you a little idea of what we do here at the clinic. And then we're going to move into like an interview style session with our CEO at Brand New Day, Steve, alongside with us. We're going to finish off with a testimonial, and then we'll open it up to any questions and answer portion if anyone has any questions out there. So to begin, we'll just kind of give you a little bit of a look into what we do here at the clinic with our welcome video.
Well, I mean, some of the more stunning examples of positive results from both light therapy and electromuscle stimulation would include patients who literally could not walk for several years and now can walk as a result of the EMS that they got with Neuro 20. We've seen patients with Parkinson's and a history of tremors mitigate those tremors for long periods of time just based on the effects that light has on that particular condition. We've seen patients with significant drop foot where our electromuscle stimulation and the combination of light therapy has eradicated it from their life 100%. They don't have drop foot anymore. Those are types of things you don't just see anywhere. Patients with multiple systems atrophy, where an individual, who's a little more advanced stage may walk a little bit like kind of C-3PO from Star Wars, right? It's not exactly smooth and fluid, but within just a few minutes of using the suit, they can walk in a normal fluid fashion like you or I can. And more importantly, when you turn the suit off, your question is, will that hold? And the answer is yes, it will, at least in the immediate sense, days, weeks, etc. Now, we have a patient who came to us after having had a stroke about 15 years ago, and as a result of the stroke had an immediate severe pain issue with the trigeminal nerve in their face. This can be a very, very painful condition. And to have suffered that for 15 years with really little effect from other types of therapies, when we used our Firefly infrared and red light, almost instantly the pain was reduced. And now that individual comes in for maintenance visits. In his own words, it's the first time that he had been pain-free in 15 years.
Awesome. So now that we have a little bit of an idea of some of what we've done here at the clinic, a couple of examples, we're going to go into an interview now with Steve Sanborn, our CEO, just to kind of touch on some of our frequently asked questions, some questions that you may not think to ask, but are wanting to know. So we're going to start with our questions here. And Steve, are you ready?
Yeah, I'm
Awesome.
ready to go.
Awesome. Our first question. So Steve, what makes Brand New Day's track and treat model different from traditional medical approaches?
Well, the track and treat model has really kind of been a creation or thought process of mine that came out of a number of years of working with the devices and seeing that it was very reasonable to be able to measure a problem and then treat the problem and then measure again to see what kind of success we have. So, in addition to that, I would say timing too. It's very much a real-time experience for clients who come to Brand New Day, particularly measuring brain health, overall body health, gut biome health, etc. These tools are fast, non-invasive, and very quick to generate an accurate report. So in a lot of cases, we can show our clients their results same day while they're actually still here. That doesn't mean we can always do that. Sometimes there are other things going on, but we can get back in touch with them pretty quickly to let them know where they stand with their overall brain health function or brain state, what their cardio and vascular and autonomic nervous system is doing, amongst other scores that we can capture very quickly. So, to me, I think having been a patient many times in the past in my life, there were times when I did a screening and I never heard a thing back. Um, and generally, you're supposed to assume that that probably means there's no problem, but you don't always know that as a patient. So I want to function at a higher communication level, mainly out of respect for our clients. I mean, we're all human beings here, and we're all wanting to get to some of the sources of our problems. We happen to have the capacity now, with technology being where it is, to measure very quickly, very accurately, and in pretty much real time, and then begin a treatment process that will absolutely improve the scores or the numbers or whatever it is we have, and as far as our reports go. So as a quick example, brain health, if we're looking at, say, low amplitude and possibly some low autonomic scores, say cardiac autonomic scores, over a short period of time with the use of our electromuscle stimulation and our light therapy, we can absolutely get those scores up to where they ought to be or close to where they ought to be over a short period of time, sometimes weeks or a couple of few months. But the object is to measure along the way to make sure that we're actually getting real results. So that I think in some ways and shapes and forms feels different and is different than what individuals may experience in a more conventional system.
Absolutely. Absolutely. And yeah, I think alongside that, it's one of those things where when we're working with clients, the kind of not so in your face objective data is available probably in some of those medical approaches, at least in a non-invasive way. So being able to capture data in a non-invasive way is also really cool. Is a cool way to capture that data and provide that track and treat specific to each client. So I
Right.
think it's pretty fantastic.
Yeah, I agree. And we've had a few scenarios in the past where sometimes people may have a little bit of worry or anxiety about the scores that they're going to get, and I always tell them it's the best to know, or that's the best case
Hmm.
scenario, is to know what are we dealing with and how can we fix it. And with regard to our EEG platform, we're capturing purely biological functions or biomarkers in the brain. So we're not measuring other aspects of, say, thought processes, or if somebody, I've had people ask me, does this measure my intelligence? No, it does not. It's simply measuring on an electrical basis what your brain is doing and perhaps what it ought to be doing. So we keep it comfortable, obviously. These types of screenings go by fairly quickly. They're not terribly difficult. They're comfortable enough, certainly non-invasive, as you said, and highly worthwhile doing, at least every once in a while, at least every year, every other year, to just kind of get a standard operating procedure on yourself, right? Just to get a snapshot of what's going on under the hood. So it's been a fantastic experience working with the tools that we have because they are so advanced.
It's incredible. Incredible. Awesome. Thank you for that response. We'll go to our next question. Awesome. So again, kind of understanding the brand new day approach. how do you determine which combination of technologies, like the Firefly device, like the Neuro 20, is right for someone's condition? How would you determine the right combination of those technologies?
Well, I think first from a high level, we know for certain that the approach with EMS, electromuscle stimulation, and light therapy is not going to harm anybody, right?
Mhm.
Regardless of what circumstances they're in. So at a high level, we can use these tools with few and rare exceptions without any contraindications. Now, the real question there, I think, is how do we dial in and specify the use according to a particular condition? And a lot of times we're leaving that at first up to our medical director, Dr. Anderson, to determine what's going on a health basis. So if we're dealing with a neurological condition or autonomic nervous system condition, or an injury, for instance, or perhaps a head injury, um, each of these can be dialed in a little bit more closely and a little more accurately with regard to the type of modulation or the modality that we're using, right? So we can use electromuscle stimulation in a number of different ways, just as we can use our light therapy in a number of different ways. So, as an example of light therapy, for instance, if somebody has deep sciatic nerve pain, we're obviously going to be focusing on infrared because of the depth of permeation that it has with soft tissue. In another case, we might be dealing with a surface level wound, which is more dependent upon blue light as an antiseptic, so to speak. And so each of those cases is going to kind of show the demand that is on us as far as how do we calibrate our overall protocol. And then when we get into real serious situations, especially neurological conditions, we also fall back on another battery of doctors, if you will, the medical directors at the manufacturers of the devices we use. So in this case, Neuro 20 would be a good example. And when we have a special situation, we know that we need to kind of stop for a moment and build a plan around that individual's needs. So we start with Dr. Anderson, of course, and then we move on to some of the other medical directors at and around Neuro 20 who are more than happy to work with us. And I think this also demonstrates a difference with Brand New Day as opposed to other more conventional clinics. All of this really began several years before we opened with very good relationships with these manufacturers. So we know our manufacturers, the CEOs, the medical directors, not just on a first name basis, but on a friendship level. We are
Mhm.
on the phone with them 2 and 3 times a week. They are very interested in the feedback that they can derive from our work here at the clinic. And so they're really, really helpful and glad to be helpful in aiding us in designing the best protocols, based on the modality, and then how we can combine those two wherever it is appropriate. And I see unique results as a result of that.
Absolutely. Yeah, and just speaking on behalf of my experience here with Brand New Day, um, absolutely commend you on your partnership with Dr. Anderson, but then to continue those relationships with the creators and the CEOs and those who live in this world with each of those medical devices, it is fantastic where we can kind of reach out and get extra customization done, whether that's the kind of light we use or the stimulation time versus rest time on some of our Neuro 20. So just honing in on those relationships have been incredible in providing the best services to our clients. So definitely want to commend you for keeping those relationships. It's
Yeah. Oh,
amazing.
thank you. Yeah, I think
Yeah.
persistent good communication with these types of individuals is only going to lead us in the right direction. And I'm grateful to them for being so willing
Yeah.
to sometimes drop what they're doing in the moment to come to our assistance to develop something. Sometimes literally mid-treatment. Sometimes we will customize or have to change. We're acknowledging that something is or isn't working well, so we need to kind of shift our approach in real time. And just the ability to be able to text, right, medical directors in different parts of the country and get fairly immediate responses. It's never a guarantee, obviously, that we'll get immediate, but we do oftentimes get their attention quickly and they're really willing to help. So that's made a huge difference in a number of the outcomes that we've had with our clients.
Absolutely. Absolutely. Love it. Great. I'm going to go to the next question here. Awesome. Steve, what would you say is the science behind using light therapy and neuromuscular stimulation together? Do you have any kind of science-based kind of evidence on how this works?
Well, so I will speak to that on a layman's level to presumably mostly lay type people and say, firstly, that there are just reams of medical research studies, both on the photobiomodulation or light therapy, as well as electromuscle stimulation. And some of that research is really, really interesting. But I would say predominantly from an electromuscle stimulation perspective, we are really following the most cutting edge or the most and most relevant research that shows how specific use of EMS has a direct impact on the brain in a positive way and re-engaging the brain and the body as one functional unit. When we look at infrared, for instance, and again, taken from a layman's perspective, we know for certain that infrared light, red, blue, help to increase blood flow and decrease inflammation. Now, if I just focus on those 2 points for a moment, because it certainly does other things. If you have an area where, say, you maybe have pain or injury or neurological challenges, numbness, tingling, whatever the case may be, I think my first premise or my first basic question was how could it be harmful to increase blood flow and decrease inflammation in an area that we plan to also treat with electromuscle stimulation to improve the signaling that takes place in the nervous system? And nobody could say anything negative about the idea. And so if I say scientifically, we know for certain that these light treatments do in fact increase blood flow and decrease inflammation, which they absolutely do. And then introduce our whole body electromuscle stimulation suit to start working on the signaling, say, that's taking place along the nervous system, right? Bilateral drop foot would be a good example of a patient who injured the lumbar spine and as a result could not get the feet to function normally. They just kind of flop down instead of dorsiflecting, et cetera. So this is, I say, a key example where light on the injury site, as well as in the legs, below the knees and the feet, et cetera, helped greatly to increase that blood flow and decrease inflammation that might be sort of impinging, if you will, or putting pressure on a nervous system that really needs to be reawakened. And so the results that we got there were an ability to move the feet to a certain extent. I'm not going to say it was 100%, it was not, but it was certainly an immediate improvement within about a week and movement that he was incapable of before. Standing, balancing, walking more quickly and with more assurance and confidence. A number of improvements there that were so telling that he was literally willing to get on a national radio show to talk about his progress. So to take it back to the science side, we base what we do off of research, which is more or less communicated to us through protocols that are developed by these practitioners and medical directors that I mentioned. So we take that as sort of our starting point. But then, to be honest with you, we see and discover certain things happening in the moment, and we provide that feedback to the medical directors as well. And that gets worked into everything that they are continually working on. There have been times when I've communicated back to the Neuro 20 medical director, Dr. Palermo, on certain scenarios. For instance, with Parkinson's, and a patient saying, "Yeah, after that session, I was much more limber, and my vocal capacity and my speech capacity were significantly improved for the first 36 hours." Dr. Palermo still expresses huge surprise and, eureka at those types of moments because, this isn't just happening anywhere in the country. We have a rare combination of tools here that make it very relevant for someone with a Parkinson's diagnosis. And honestly, knowing the research as we do and the protocols as we do, it's very possible that we still get even additional positive outcomes that we don't even know to expect. So this is the kind of thing that is almost helping to develop the science, if you will.
Hmm. Yeah, that's a great point, and just kind of understanding how the research aspect of it, of photobiomodulation and light therapy and neuromuscular stimulation. There's been years of research on that to then having these manufacturers develop these amazing tools with all that research. It feels like brand new days on the cutting edge of taking both those research things, and now we're kind of coming up with a new bucket, utilizing both of those. So it's a pretty cutting edge approach that we have here at Brand New Day. It's pretty awesome.
Totally agree. Yeah. And then when you can match that up with the measurements that we've already described, when we know that
Exactly.
it's going to make some improvements with brain state and overall physical health, internally speaking, now you have patients who are giving sort of an anecdotal representation of improvement. They're telling their story to people and saying,
Yeah,
I'm 50% better, which we've had patients say. But then we can also show that objectively with
exactly.
our measuring tools, measurement tools.
Exactly. Yeah, going back to that track and treat approach and getting that objective data rather than that symptomatic data that we can't necessarily see. So
Right,
fantastic.
right. Yep.
Awesome. Love it. Thank you. We're going to go to the next question here. So this is kind of a two-part question. I'll see the best way to kind of get that. So can our testing and therapies, I can kind of maybe focus on the testing aspect of it and our measurement devices. Can that help identify the root cause of pain, fatigue, or imbalance instead of just treating symptoms? Or how do our tests reveal what's happening inside the body before the symptoms appear?
Yeah, well, I would say certainly in some cases it will point directly back to a root cause, or at the very least, it will confirm what the patient is feeling or believing to be true about their own circumstances. That's very important to listen
Mhm.
to the people who come here as clients and describe what they have been dealing with. They know their bodies, they know their minds, they know, as any of us would, if something isn't right. But in certain cases, if I were to use something, let's say a little simpler, like a head injury, if somebody suffered a mild traumatic brain injury, let's say six six months to a year ago, and they say, I really haven't been right since. In other words, I'm just not completely healing and getting back to normal. Um, Other people around them might say, well, you seem fine to me, but without some kind of a way to really capture that in an objective way and confirm that they are either correct or potentially incorrect, that's always possible too. Um, we can do, for instance, the EEG, our WAVi platform, will show
Mhm.
specifically the symptoms of a persistent concussive state, as opposed to a fresh injury. So, for instance, if you got a concussion 2 or 3 days ago, we will see a certain uh, set of data in the outcome of that report. But if it's been a longer persistent concussive state, it will look different, and we can see the distinction between the two scenarios. And that would confirm to somebody, I knew it, I knew this wasn't right yet. And then we have ways to treat that and get them out of that persistent concussive state. Just
Mhm.
this morning, we had a patient in who has he is here because he's complaining of essentially neuropathy in the hands and the feet, for instance. And when we did our TM flow screening, it absolutely objectively shows that his microcirculation is very compromised. So it's not just in his head, is I guess what I'm trying to say. And nor would we treat it like that, even if we didn't have TM flow. A person obviously knows if they've got some kind of neuropathy in their feet or their hands or other areas of the body. But yeah, so in certain circumstances like that, we can very easily confirm. Now, to get to the root cause question, we can continue to use the neuropathy, which is a symptom of a greater problem. But in this case, the patient already had a previous diagnosis of type 2 diabetes. So he kind of knows that. We could certainly make that assumption. Dr. Anderson could certainly dig more deeply into the patient's history and make some determinations clearly that there's a type 2 diabetic situation going on. But then the question is, can we aid that patient in not only reversing those symptoms, but really in trying to get to a whole new level of health? And in some cases, the answer is yes, we certainly can. That takes cooperation on the patient's part, of course. And in that type of disease state, you're looking at changes in diet choices, supplementation, possibly exercise, hydration, all the standard things we're supposed to do to keep ourselves healthy. And so we can certainly guide a patient in getting to major changes in root cause scenarios, just depending on what the circumstances are. Now, if you're talking about, say, MS, we've treated and do continue to treat a patient with MS who in the initial stage already obviously knows her diagnosis. It's now 20 years later. She's unable to make appropriate use of her feet, for instance, when she's stepping out of the shower. But after just a handful of sessions with Neuro 20, she doesn't have that problem anymore.
Mm.
She had what she referred to as 9 to 10 level pain in her hips for many years. And literally in the second session, it became a zero and it has stayed a zero since. That was months ago.
Yeah.
So yeah, getting at root causes is possible.
Hmm.
Certainly maintaining some of the symptoms that may come along with that is something that's very quite simple for us to do in a lot of different cases. So I think it depends just on each patient
Yeah.
and some of their other lifestyle scenarios and how those might be changed as well.
Yeah, absolutely. And kind of my best practice that I like to use, we're talking with people who aren't necessarily a client of ours yet, those of clients that we do work with that are finishing up a package with us. I always try to encourage them to, just like an annual physical, get your annual measurements with us because while you're feeling healthy, whether we treated you or not, and you're going through year after year, symptoms may not be coming up, but every year we'll kind of compare the data from previous years and see any trends that might be leading to something that before you start feeling those symptoms, our data is showing this is kind of the progression that something's happening. So I just wanted to highlight how we encourage folks, even if they don't have symptoms, come
Yes.
and encourage you to do an annual kind of measurement with us just to kind of keep track and see how things are going before something does happen. And now
Yeah.
we don't necessarily have all that data to kind of work off of.
Absolutely. Yeah, no, I
So,
agree. It's like testing the battery under the hood, right? You want to make sure that thing is ready to roll before you take a long trip. And so in a certain sense, I don't see it as really all that different. It's a matter of
yeah,
checking under the hood, making sure that our vital organs and our normal processes are functioning, and sometimes they can start to go a little bit south on us and we don't even realize it. I mean, it's clearly neuropathy can sneak up on anybody and they don't even realize that they have numbness in the feet. And that can become a problem with falling or other, aspects of functional life. Um, but the key there is having really this unique combination of EMS and light that enables us to reverse that and get people back. Now, I'm using neuropathy as an example. There's plenty of other conditions that we can work with on that level, of course, but
yeah,
to be able to turn those things around in people's lives and get them functional and living and acting and doing all the things they want to do again is a pretty big deal around here.
great. Awesome. Thank you. We're going to move on to the next question. Awesome. So, how do you track a patient's progress over time, and what kind of result data do you share with them? I know we touched on it a little bit, but do you
Right. Well,
have
I
like
can get a
a
little
kind
more
of,
specific, and
yeah,
it may not be the most exciting thing, but that's okay. I mean, with regard to the WAVi EEG, we're looking at brain state, and we're measuring some very specific biomarkers that we would expect to behave within a certain column of normative data, if you will, or within a certain threshold. I oftentimes use the example of a thermometer or a scale in a weight loss program. These are ways to capture objective data. They don't necessarily point to the cause of the issue. So if I have a fever, the thermometer is going to say it's 103. We all know where it ought to be. And so we can try to then, or a physician practitioner can start to determine, well, what's causing it? to be 103? How do we get it back down to 98.6? And this is the same kind of approach that we take with the EEG. It's not a diagnostic tool per se. Your practitioner is the diagnoser, if you will. That's where you
Mhm.
get the diagnosis from. So this adds in some very helpful objective layers of data when we're trying to determine what's going on. And some of those facts and figures are the P300, which is a special wave the brain produces, and we can measure that for both its speed and its electrical strength or its amplitude. Then we're also looking at other markers that would help us to determine if a patient or a client is dealing with any kind of depression or anxiety, ADHD, other more serious issues like, say, dementia, Alzheimer's, et cetera, Parkinson's, things of this nature. All together, we really kind of look at 7 different measurements from our EEG, and based on how they play out together, whatever variables we can see, that will give us a very, very strong direction with which to work. And then when we match that up with the TM flow and we're looking at cardio and vascular and circulation down to the micro arterial level, and pseudomotor and sweat response, and endothelial marker, which is the integrity of the inside of a person's arterial walls. If those are agitated or inflamed, we will know within about 15 minutes. And that's a very important type of marker to have your eyes on, because you don't want to walk around too long with severe scores in an endothelial measurement. But we can make that change over time, and we've seen that objectively by doing just what we described earlier, which is to track and treat. Measure that problem, land on the fact that there's a severe marker that needs attention, go through the treatment process, and get the body, believe it or not, to start healing itself. This is kind of one of the discoveries that these tools has allowed me as a layperson to sort of see more clearly. And that is that, there was a time, and there still is in certain conditions, where practitioners or anyone would naturally think rightfully that, well, this is permanent. The problem you have is permanent. It's not going to change. But that isn't true in a lot of cases now. And that isn't criticism or skepticism of the system at all. It's just that these tools have enabled us to acknowledge more clearly now that we're looking a lot of times at dormancy, where the neurological system is compromised through whatever cause, and the patient has never really been able to make progress, say, after point X and then beyond. So they remain in a wheelchair, they remain using a walker, they remain in a state of contracture or paralysis, whatever the case may be. And what we're seeing is, if you can get messaging into the body through the nervous system, up the central nervous system and into the brain, which is what we do with our Neuro 20 system, for instance, we can start to achieve brand new types of results that these folks have never experienced before. And in part, we have to rely on that objective data also to prove it out, right? I mean, there is such a thing as a placebo effect, which is a more of a neutral statement. I'm not saying it in a positive or negative direction, but and that's not always bad to have that kind of a placebo effect too. If it gets somebody moving again or they can feel something again, great. What's wrong with that? Nothing. So at the same time, though, we want to be able to look at those markers and, say, in a dementia case, be able to prove it out. It's one thing to improve one patient's life. It's another thing to improve that patient's life significantly with data that we can explain then to larger groups and larger communities, so they understand there's a possibility that they could mitigate or reverse dementia. I mean, who would think 5 or 10 years ago that that would be discussed? And yet here we are doing it, and we've seen it with
Mhm.
our own eyes. So hopefully that helps people understand a little bit more about sort of the scores and how they relate to the outcomes.
Yeah, yeah. And I will say, working with the three different measurement devices that we've worked with here, they have a pretty sophisticated and very digestible report that I'm not a doctor, but I can clearly kind of understand what the data is showing because it's presented in a way through the reporting that's
Right.
pretty consumable. Is there anything in terms of the presentation of reports or anything that you wanted to highlight?
Well, I mean, when it comes to looking at some of these reports, they can look a little bit science-y and
Hmm.
all that kind of stuff. But we take time to sit down and explain in detail what it is we're concerned about or what our focuses are with a given report. And I try very hard to speak in terms that are not super high level medical. I want
Hmm.
people to understand what's going on. And so, that's why I give the analogy examples of like, the thermometer with the fever, et cetera. So people understand at some level what it is we're trying to do. With regard to a P300 wave, what is that? Well, it's a natural organic wave that the thalamus produces deep in the brain when it hears a particular sound, an auditory challenge, or even visual challenges. It's just a natural occurring thing that the brain does, but it ought to do it at a certain strength and a certain speed. And when it's not doing that, and we can capture that and see it objectively, then we know something else is going on that we need to sort of ferret out or root out. So keeping it as simple as we can for the patient. In some cases, we also produce patient-styled reports that they can take home because they may want to share this information with a spouse or somebody else in the family, or maybe even another practitioner. And so
Hmm.
we try to keep that as understandable as possible, all the while knowing that sometimes it can be maybe feel a little daunting to understand at all. But
Yeah.
yeah, but we're always willing to sit and clarify and explain away as much as possible what's going on with these reports and their custom scores, and then
Yeah.
start working on improving them if they need improvement.
Absolutely. Yeah. That's one of the things I was impressed by is how efficient the report is and how much data they can kind of get into one PDF for you. So I
Yeah,
think it's pretty incredible job what they did
I
to
agree.
kind
I
of
totally agree.
capture all the data that they're collecting and present it to the doctor to kind of analyze that and interpret that.
Right.
Awesome, 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 awesome. I'll move on to the next question. So, Steve, what kind of improvements do patients usually notice first? And how soon after starting treatments, how long do they last when it comes to just noticing anything, any change that's happening? Can you speak to that at all?
Sure, yeah. Well, of course, everybody's different. It depends on the condition. We oftentimes see sort of straightforward pain type scenarios make progress very quickly, oftentimes in the first visit, specifically if we're using light therapy. It has a profoundly quick or fast um, turnaround. And I oftentimes have to tell people, well, that hip or that shoulder that was hurting so much, and now 15 minutes later, you don't hardly notice the pain. Don't go home and pretend like it's not there, right? You're not ready to go back out and do the thing that caused the injury in the first place. So I do encourage people on that front to kind of take it slow. But when it comes to results, I guess what we're kind of getting at is I would say that we have seen results that range from wound care to pain to neurological challenges that are pretty significant as quickly as one or two visits. They start to see and feel and experience noticeable progress. That is not a point at which we would stop and try to measure objectively again, right? We would wait probably at least weeks, if not months down the road, because we really want to kind of build a new context in the
Mhm.
body. But we have seen pretty amazing results very, very quickly. Again, because we're introducing these signals to the body and the body's responding. I'm thinking of a patient who was in somewhat of a paralytic state, wheelchair quite a lot, occasionally walker. And that's a 12-year period of time for this young patient of 23 years. And on day two was saying, well, I'm not really noticing anything yet. And I said, I know. I get it. We're working on it, but you've had this problem for 12 years, and so give me a little more time. And literally on day three, she was moving her foot for the first time in 10 years in ways that she simply could not do for the last
Oh,
decade. And
yeah.
so, these are quick responses. Does that mean that everybody will get that? Certainly doesn't mean that. And I always am careful to tell all of our clients who want to know how long will it take for me to notice a difference and how long will that last? I can't see into the future, of course, but I do tell them that I can look at a past and present group of patients who have done quite well, who have similar types of conditions or problems that they are presenting with as new potential clients.
Mhm.
So I just kind of let them know that we do get very good results. I don't make promises because I can't see into the future, but it'd be nice if I could. But as it
Yeah.
is, and that to me is just a reasonable response. We're not here to promise the moon. We're here to,
Oh,
offer the opportunity to take a shot at using tools and advanced technology that is getting very fast results for a large percentage of the people who come. Some people need
yeah.
days or weeks, though. We've had some where maybe it's going to be a couple of weeks because they're only able to come in twice a week. And that's okay. It's just going to take a little bit longer, but we do achieve the results in the vast majority of the patients or the clients that we have here.
Yeah. Yeah, and I mean, I just know that we're all built different. We all have different DNA. We all react to things differently. We all have different allergens. So
Right.
understanding we're all different from each other. Some people their injury happened years ago. Some people it's happened yesterday. So there's a whole kind of different variables that can kind of change case by case. And as someone that's worked with these therapies, kind of just some of the quick things that come to mind from people's feedback and some clients' feedback is when it comes to the Firefly and the light therapy, kind of the first things that they notice are just relief, whether that's mobility, someone's shoulders in pain after a
Yes.
session, that can go up. If there's pain, if there's wound, there's just I've noticed the relief is something that's really quick and kind of the first thing that people notice. And then when it comes to the Neuro 20 muscle stimulation, feel like every single time the first thing people notice and they bring it up to us, not us really asking them, is we just have I have so much more energy than I used to. So
Yeah.
they're able to do things longer. They're able to, and that's just relief from if they had knee pain, they're able to walk longer. And I
Right.
just noticed with the muscle stimulation, they have increased energy. That's kind of the first thing I'm noticing. And then relief when it comes to the light therapy.
Totally agree. Yeah. And again,
So,
that is sometimes the body needs a little bit of a kick in the pants, is the way I usually
hmm
will say. And these signals do that. And the
yeah,
brain and the gut and just the
yeah,
overall neurological system sometimes can get a little bit bogged down and for numbers of different reasons. But when we introduce it, you're absolutely right. The other thing I hear, and you might have already said this, but much better sleep.
hmm
I just heard that this morning. Oh man, I slept so well. I'm like, well,
hmm
we're kind of giving your body a bit of a reboot, if you will. I know
hmm
that's more computer language talk, but
yeah,
in a sense, that's kind of what we're doing. We're kind of rebooting the system, and undoubtedly, people see and feel and live those positive differences.
absolutely. Amazing. So I'm going to go to the next question here. And would you say that the therapies at Brand New Day, are they effective for people who have tried everything else without success, or who are kind of the people that have just given up on going out there?
Yeah.
Is this good for those types of folks?
Undoubtedly,
Mhm.
at least a good portion of the population of clients that come here have tried many, many other things over the years, and either got no results or maybe got short-term results or maybe plateaued. They may have gotten, say, a 40% improvement of some form or fashion.
Yeah.
And then they're still left with searching. And a lot of times that's for pain or neurological injuries.
Mhm.
Those are the types of things that everybody, they just want to be able to find that solution that's going to get them back to the way they used to be. And again, like I said,
Yeah.
we're not here to make 100% guarantees, but absolutely we've seen people come after trying many, many other things and then get the very best results they've ever had here.
Yeah.
And again, I associate that to directly to the brilliant minds that have created the tools that we use, and then just our observational perspective that when you combine the use of these tools, you can easily get unique results, or let's say better results than if you were just using one of these tools, right? So the
Yeah,
combination does definitely seem to offer to many clients an opportunity that they can't find elsewhere.
absolutely. And I would even say the proper use of these tools together. I know, for example, for those of people who are like, I've done an EEG before to get measurements, I've done light therapy, I've done muscle stimulation, it's not working for me. Don't
Yeah.
think that brand new day is not a great place to try, even if you've done those things before. Um, I
You're
know with
making a very good point.
the Neuro 20 and the Firefly, for example, there was a client who suffered from extreme pain. They have chronic regional pain syndrome, and they've gone to pain clinics before, and they've done muscle stimulation, and they've done light therapy, but it wasn't done properly for them. We believe they've received too little light, too much muscle stimulation. And when we're working with them, we're going to kind of do the opposite. We're going to kind of do low and slow with the stimulation, bring up the light. So even if you've come across these um, therapies before, Brand New Day has an approach that's different than what you don't find. And again, it's kind of combining all these together with the proper use of our measurement devices, with our EEG. It's going to be much different than when people think of EEG. It's going to be that 24-hour sleep test where they're connected for 24 hours. This is a quick 4-minute P300 test. So
Yeah.
don't if you think you've done these before, I would kind of throw that away because the way that we do it is going to be a different approach.
Well, absolutely true. And also just the level of technology, the advancements and the tools that we use versus what they may
Mhm.
be familiar with out there in the greater market.
Yeah,
We have clients who often say, well, I bought this red light thing that I use at home. And I say, that's great. Use it. That's
yeah,
fine. It's not going to do you any harm. But that is not
yep,
what we're doing here. So if I look up into the sky and I say, hey, look, a plane. Well, am I talking about a biplane that was created by the Wright brothers, or am I looking at an F-35? Right? This
right,
is the distinction that is made with the types of tools that we're using here, right? Not just with the measurement tools, but the treatment tools. And electromuscle
absolutely.
stimulation is sometimes thought of by people who don't think about this as often as we do, as say
Hmm.
like a TENS unit. Nothing wrong with a TENS unit. I use one at home sometimes. It's a great thing. It's a two-channel deal that you can put on your arm if you've got tennis elbow, and it'll help to channel pain away for a little while. But we are not using a TENS unit here. We are using a whole body electromuscle stimulation suit that is taken up multiple layers or levels, up
Yeah,
those varying notches to a level of advancement that is reconnecting brain and body function. All right, TENS units will never do that. In
yeah,
the world of photobiomodulation, red light is great, near infrared is great. We're using a tool that permeates soft tissue 8 inches deep. You cannot buy a product on the market and in a home environment
yeah,
like that, right? This is something that people come here because nothing else can reach the
yeah,
cause of the pain without being cut open. And a lot of times
yep,
these days, people don't want that. So it is worth it, like you say, not to form an opinion of what we might be doing here based on knowledge of other forms of similar technology. We are definitely in a realm that is very different than what they would see on the standard market.
absolutely, absolutely, love it. Well, we go to the next question. We should be coming up with some of our final questions here. Appreciate your time with us, Steve. Okay.
Sure thing.
Are there any risks of overstimulation or doing too much when it comes to our therapies like Neuro 20 and Firefly?
Well, I would say only in untrained hands. I mean, is it possible to turn
Mhm.
something on and leave it on too long? Yes, but we have training to use these tools, particularly Neuro 20 and the Firefly photobiomodulation or light therapy. We know
Mhm.
where the limits are. We also know that people are oftentimes coming with very sensitive circumstances. If they've done EMS in the past before, they may have experienced something where a practitioner wanted to push the limits of the signal to see what they could tolerate. We don't do that
Mhm.
here, especially with sensitive neurological conditions. We start low and
Mhm.
slow. We don't want to send a bolt of lightning down a cell phone charger cord, is what I usually say. What we want to do is acknowledge that the best approach may be a simple sensory level use of these tools to get a client acclimated and to really track carefully how they respond. I mean, I can
Mhm.
say, with assurance that the vast majority of our clients react similarly, and we pretty much generally can forecast where that will be, but we don't make any assumptions either. We
Right.
start low and slow with light now, or rather with the suit, with the EMS. Now, conversely, with light, we've also had clients come from other places where they were very underwhelming with the use of infrared or red light. There is an area where higher intensities can bring very fast and quick results. That's not to imply pain or discomfort. High intensity infrared is merely something that will permeate soft tissue, like I said, quite deeply into the body and reach the areas that are compromised or causing whatever the problem may be. So, yes, I mean, look, anything can be used incorrectly, but we are well trained and take our
Mhm.
protocols from a fantastic medical director, Dr. Anderson. And so we don't tend to have issues like that here at Brand New Day.
Yeah. Yeah, I would just say as someone who's been trained in these devices, they have a great training program with folks who've done this for many years. And again, along with your relationship building, they provide us with a blueprint on treatment protocols, which are great. But then if people are doing well and we want to kind of ramp things up, we just communicate with our doctors, and
Right.
um, it's been a pleasure kind of understanding and seeing the protocols that we're provided, and then also kind of that collaborative approach with doctors as well.
Right. Yeah,
Awesome.
absolutely.
Very good. We'll go to the next question. What would you say are some of the most common misconceptions people have about these advanced therapies, like the Neuro 20, like the Firefly? Um,
Well, I would harken back to a little bit of what I said earlier, pardon me, in the last answer, and that is that they may have impressions based on experience or knowledge of other similar tools. But again, a Model T is a very, very far cry from a Ferrari or a Lamborghini, right?
mhm.
We can't just say car anymore. Well, what type, what model, what year? All these things matter because we know there are iterations of advancement. We are at the other end of the spectrum when it comes to the iterations of advancement and the developments with both light therapy and electromuscle stimulation. So a great deal has been learned, even in the last handful, say 5 to 10 years, that is continuing to teach even the medical directors at the places I mentioned, like Neuro 20, where they're seeing unexpected results with neurological conditions that otherwise would have been thought to be permanent or unchangeable. So we're kind of living in a real-time situation with these advancements.
Yeah.
And so I would say one, infrared, red light, most people will refer to things as a red light. Oh, yeah, I've done red light or a red light sauna, or I've done things, with red light. And I say, that's great. That's fine. Probably the intensity levels you experience with that were much lower than what we use here. Nothing wrong with that. It's not going to harm you in any way. And I even recommend if it makes you feel good and then continue to do it. What we're doing is a much more focused approach. So sometimes people say, well, is it similar to a sauna or is it similar to this, that, or the other? And then we just have to give a basic description that we're usually focusing on a small area of the body at a very deep level. But we keep these tools, to keep the wands moving, so to speak, keep them moving around. Number one, because we don't want to get the skin too warm or hot. But in any case, it really enables a vast change in that area of the body due to, like I said, the increase in blood flow and the decrease in inflammation, just as two main markers of what we can achieve with this tool. that also enables the body to generate more ATP, which is a protein that comes to the aid of our overall nervous system, our neurological system. The light causes the body to produce more of that, which over time, as we age, we produce less and less of. And so, the impressions may also be something along the lines of previous experiences with EEG, right? I once had a practitioner tell me that as a little girl, she had epilepsy and had to have EEG with a big, huge, clunky hospital system. There, everything took an hour and a half to put all the leads on her head. And she had really bad memories of that, right? That had a deep impact on her. When
Mhm.
she looked at what we had to offer with literally a 5-minute setup, a comfortable rubber cap, easy to use electrodes, etc., she literally broke down crying and just said, God, I wish this had existed when I was younger. Um, so impressions about the tools and the technology that we use can be based on a previous understanding of a different type of device or
Mhm.
experience. So, like you said, we kind of ask people not to rush to judgment about what it is we're doing here, but to certainly communicate with us. We're always happy to do consultations at no charge or spend time on the phone or on a Zoom call, explaining what we do, how we do it, who's involved, and what it all means.
Yeah, I love that answer. Thank you. We'll go to the next
Mhm.
question here. How can someone know whether they're a good candidate before starting? Do you have any advice?
Um, I'm not sure. I mean, other than to simply say, like we've talked about earlier, I've tried a lot of other things that haven't worked. Certainly, that doesn't make up the entire population of clients that come. Sometimes they're here because something literally happened a day or two ago, and they need it to go away quickly because it hurts.
Mhm.
Um, so certainly, if they're dealing with acute or chronic pain, if they have a long-standing neurological condition, um, and then maybe on the flip side of that question is obviously we always have to check to make sure that there aren't going to be contraindications. Typically, if somebody has a pacemaker that can present a challenge using our Neuro 20 EMS system, I think it's worth discussing it, but we do need to know that. No problem with the light on that front, of course. But pregnancy or an active cancer, these types of scenarios could very easily push them out of a normal, accessible candidate sort of position, if you will. So we do need to know a few things about overall health, obviously, but
Mhm.
certainly if somebody's tried many, many things and they're at their wits' end, I would say we are very worthwhile
Yeah,
trying. Yeah. And it doesn't
yeah,
necessarily have to be for months and months and months. We're not looking to drag things out. In a lot of cases, people could know in as little as a month or two whether they are making some form of acceptable progress. And if so, then of course, we recommend pushing that further out and getting them the best result possible.
yeah, yeah. And I would even say, I would encourage people to, yeah, get a free consultation with us. Come in, let's get kind of a health history assessment of what's going on.
Yes.
If after that there's still some uncertainty, let's start with our measurements and get some objective data to
Yes.
then really identify this is what's going on in the brain, within the body, and then from there we can kind of piece together from various conversations and various data that
Yes.
with this is going to be the kind of tailored program that we believe is going to fit for you.
Well, then
So I just
finally, yeah, absolutely. Just going to say, finally going, getting in a little time with Dr. Anderson, right?
yeah,
And reviewing those reports and
yeah,
laying out a medical history, and then he's going to be able to, you know, absolutely confirm whether a person is a good candidate. Most people end up being good candidates, I mean, and
yeah,
get good results. But that would be kind of the journey of finding out, learning what we have to offer, going through the screenings to get some scores, and then building a plan around that.
yeah. And I would just say, yeah, it's the first part of the track and treat equation. Let's track, see what your history is, see if there's any data, and then determine candidacy or not. So
Yes.
love it.
Yeah.
Very good. Next question. Are there signs that someone's nervous system is overloaded and needs recalibration?
Well, sure. I mean, definitely if a parasympathetic nervous system is stressed or kind of, let's say, stuck in a certain mode, oftentimes people will present with a lot of tension, possible anxiety, different states where they're carrying sort of the weight of the world and it doesn't seem to be able to go away. And that could be, in some way, it can be at a mental level, but it's also just a physical, biological level. There can be things, right? PTSD would be a good example
Mm,
of a super overactive parasympathetic nervous system that's in a sort of fight or flight state, right? And for one reason or another, it can't get out of that. That's brain related, that's neurological system related. And we approach that in ways that successfully are able to pull a person sort of out of that stuck state that I'm talking about. And I've literally witnessed with my own eyes, for instance, our conditioning mode, right? We both know what that means in the Neuro 20 system, almost immediately kind of informing the parasympathetic nervous system, hey, it's okay. You can calm down. You can return to normal. And I've just seen people just like almost just melt on the table. They've gone from sort of a tense situation to a very relaxed state in seconds.
mm,
And in another similar sort of way, because as I often tell people, we're not really a supplement company, but we do have a couple that we really like
mhm,
because we see such good results. Nupanex would be one of those for brain health. In a PTS scenario or PTSD scenario, trauma can cause the brain to burn a lot of energy. And when it burns up all of its vitamins and minerals and it's nutrient deficient, it remains in a stuck state. This is partially what can define PTSD. And by reintroducing those nutrients at a high level over a
mm,
period of time of, say, 60 days, 90 days, what have you, we're not talking long, lifetime long, forever supplements. We're talking about high level concentration pharmaceutical compound that will reintroduce these nutrients. Because it's like I say, sometimes when you get a group of people that are all looking at the computer trying to figure out why it doesn't work, what's wrong with it, and then the kid comes in the room and then asks the right question. Is it plugged in?
mhm,
Right? Okay. Oh, well, nobody checked. It wasn't plugged in. Same question is around nutrient deficiency. What is wrong
mm,
with me? I don't seem to be myself. Something is wrong. What is your nutrient levels? If we're not going to ask that question first, then we're oftentimes skipping the first, and second and third step in a process to get people back to normal, right? So I
yeah,
have seen Nuvanex as an example take a PTSD scenario and put it back into a normal state in weeks,
yeah,
And so hopefully that helps a little bit to
yeah.
understand,
Awesome.
your question there.
Awesome. Thank you. This will be our last question. Um, what are some of the most inspiring success stories you've seen, and what made those cases stand out to you?
Well, I would say probably the most memorable cases are of people who have oftentimes traveled in. There are some locals too, but we do get clients that come from very far distances and they will stay for a week or 2 weeks. Um, as we've said before, because they've tried so many other things and nothing else is working. Um, we've had two young ladies as clients who are both suffering significantly and for long periods of time, right? Years. And to be able to make a change in their lives is it's almost addicting, to be quite honest with you. You realize we have something pretty special here that's working. And to see a measurable change, not just in the way that they function and acknowledge themselves, right? This is definitely better than it was, but then to just be able to back that up with the objective tracking side of the thing, is just proof in the pudding that we have something going on at Brand New Day that is special and different. And so the types of cases that I'm talking about are scenarios where it's been years of physical disability and pain and inability for just normal bodily function, bowel function. Everybody knows at least from some time in their life that it's no fun to be constipated for a day.
Mhm.
Try being constipated for a few years, right? And being very young, right? These are things that are just so abnormal to the everyday life that most people lead, that to be able to take those things off the table and improve their lives, or like the bilateral drop foot that I mentioned, to be able to see that in fact this is not entirely permanent. This can be improved, and we're witnessing these improvements as we do the treatments. It sometimes feels a little bit miraculous, to be honest with you. And I think in some ways it is. I mean, the fact that a human mind and ingenuity and perseverance were able to put these types of tools together, because the stories behind the tools we use themselves are very harrowing. They're amazing. And maybe we should take time to tell those stories at some point down the road. I'd love to tell those stories further. Um,
Yeah.
but anyway, just being able to see that, or even a local patient who over time rebuilt strength, improved some of those internal health markers, even started speaking more clearly because of the verbal limitations as a result of a stroke, going from an extra large suit to a medium in about, what, 4 months. All of those
Mhm.
improvements are so meaningful to those people. These are real people, and this is the changes that they really experience. So it's definitely become something that has to remain. Brand New Day cannot go away. We have to keep going and help as many people as possible.
Absolutely. Absolutely. Thank you for answering those questions and kind of speaking of this and kind of hearing from other testimonials. I wanted to share with everyone a
Yeah.
testimonial from one of our clients here. They just provided a little bit of a 2-minute testimonial video, so I'll go ahead and play that for us.
But it was a year ago yesterday that he collapsed on the walking.
And I fainted, fell on the ground. I didn't know it. They took all kinds of tests, and it was my aortic valve. They said if I'd laid on the ground another half hour, I wouldn't be here. They went in there and fixed it, went home the next day.
And just was so close to death. He was a different person. He wasn't a person I even knew at all. Very angry man, was very temperamental. He'd get angry at the drop of a pen, very argumentative. He started swearing a lot, which he'd never sworn in his life, and the grandkids were hearing it. Lied a lot, which he used to not do. And he was just totally different. He had been in therapy at the hospital, and he quit the therapy because he didn't think he needed it. But then with these problems, getting worse. And at first he didn't want to, but then he agreed to come see Dr. Anderson. And Dr. Anderson put him in different kinds of therapy. The changes are amazing, and our youngest daughter just came into town today. And she says, "Mom, the changes are huge." She said he has light in his eyes now. She said that was the first thing I noticed, that his eyes were just blank before. He has light in his eyes. He talks and he jokes. And he also has started singing again. He was humming and singing on the way over here. He hadn't been doing any of that.
And she said, I noticed a big difference in you, just so much different. And I knew it made a big difference, but I didn't know it made that much difference. Doing things, I'm getting back to it now, but I didn't feel like it, for a while.
Does my vacuuming.
Yeah, does all the vacuuming and everything. So I just like to keep busy. Don't like to loaf.
Awesome. I love the Johnsons.
Yeah. I love watching that
Cool.
video, especially when Gary's expressing, she says the changes are huge and he lights up.
Yeah. That's
It's a
awesome.
fun one to watch.
Cool.
And you know what? Just as a quick aside, mention, Kyle, that right there at the end there, we represented our different lab sort of concepts: brain lab, pain lab, etc., as sort of the categories in which we sort of fit our clients depending on what they have going on. and sort of to break it out that way. Just as a quick explanation, when people see that, I just want to make sure they understand that these are more or less category concepts that we use to categorize and treat our clients.
Cool. Awesome. Well, thanks again for taking time to answer those questions, some frequently asked questions that wanted to get out there into the world. And it looks like it is me and you here today, so I guess we'll just end it right here, and we'll figure out a way to upload this and share it off to the masses.
Absolutely. All right. Thank you very much.
Thank you.